this senator never thought that on the issue of the vote that we would see a vote to advance a bill that to so many feel like that it is going to harm so many of our fellow Americans. Obviously, we can disagree on specifics, but we have seen that that particular expression of opinion of harm, we've seen that expressed over and over. We've seen it in the coverage of the town hall meetings in which people stand up and say, if I didn't have this health care, I'd be dead. This senator has seen it in Florida over and over, as I have had people come up to me wherever I am, in a meeting, on the street corner, in the airport, wherever, and say, Senator, please don't let them take my health care away from me. And indeed, when I gathered up people to explain their particular circumstances, 4 different families, one family that if they did not have the waiver on Medicaid, that indeed that fellow would not only not be alive, but even if he were alive, he would be in an institution instead of being able to be cared for. Or 3 other families that brought forth testimonies about how the Affordable Care Act had given them insurance that they never had been able to get before, and it was at a price that they could afford, and it involved coverage that they never could have had. In other cases where people had pre-existing conditions, in which this senator, as a former elected insurance commissioner of Florida, had seen insurance companies refuse to insure people because they had a pre-existing condition. You have asthma, that's a pre-existing condition. In one case, you have a bad rash, that's a pre-existing condition, and we're not going to insure you. Or where those insurance policies never had the guarantee that you had lifetime coverage, but instead that the policy said that you had lifetime caps, that there was a dollar figure, that if you exceeded that, the insurance policy was not going to cover anymore. If we're really serious about wanting to fix the situation, we can take, if our brothers and sisters on the other side of the aisle are not successful in proceeding with what the majority leader is going to be coming forth, if that is voted down, and then if we're serious about it, take what's left, which is the existing law, the Affordable Care Act, and fix it. Senator Collins and I, she, having been a former insurance commissioner appointed in the state of Maine, this senator, a former elected insurance commissioner in the state of Florida, that in fact we're already working on something, a reinsurance fund that would insure the insurance companies against catastrophe. I ask for this to be costed out in the state of Florida. That fix would lower premiums 13% in the state of Florida. So in the words of Senator McCain, if we really want to get together and fix the problems, we can. And yet, in the midst of hearing from constituents all around the country who have shared their personal stories about how the existing law has helped, we are in the parliamentary position that we're in, where we will proceed on trying to repeal what is the existing law. So, but for some people, they don't care about the politics. As a matter of fact, for a lot of people, they don't care about the politics. They just want access to health care. They want what is generally described as health insurance, whether it's a Medicaid type of insurance or whether it's an actual policy through a private insurance company offered on the health exchanges in the states, or whether it is the guarantees of the coverage that they might get in an individual policy that they might buy. They just want health care. And that's the reason of why you have health insurance in the first place. Now, I've heard some fixes that say, oh, let's cut back on Medicaid, which, remember, that's spread over millions and millions of people, just like Medicare is spread over millions and millions of people. The difference there is age, because if you're 65, you're eligible for Medicare. You know, there's some people that we overlook in the system that depend on Medicaid. How about veterans? We think that veterans, they've been taken care of while active duty in the U.S. military for their health care. Then their health care is transferred to the Veterans Administration. But you know, there are a lot of veterans out there that are not getting their health care through the VA. They get their health care through Medicaid. If you start cutting back on Medicaid, which is what the versions of the bills that we've seen that are the so-called replace bills, if you start cutting back on Medicaid and making it a capped program or a block grant program, we already know the figures. It's been costed out by the CBO. The figures tell us it's about close to $800 billion cut over a decade. When you start doing that, the people that rely on Medicaid at the edges, like some poor people, or like seniors in nursing homes that rely on Medicaid. By the way, in my state, 65 to 70% of the seniors in nursing homes are on Medicaid, or some of those veterans that I told you about that are not on VA health care, Medicaid. How about some of the children's programs that are on Medicaid? You start cutting that back to the tune of about $800 billion over a decade, you're going to knock out a lot of these people. That's not something that we want to do. That's why, when explained, you've got such low numbers that support what is being attempted as a replacement if you repeal the Affordable Care Act. We should be focused on working together to improve the Affordable Care Act, not to make it worse. And so, Mr. President, I pretty well have said it all. The bills that we have seen coming forth as replacements, they change the age ratio. They change it from the existing law, the Affordable Care Act, of 3-to-1 in the health care exchanges. So an older person, you can charge them 3 times as much, a young, healthy, invincible. Not in the replacement bills that we see coming up. It's 5-to-1. What does that mean? That means for those older Americans, before they turn 65 and become eligible for Medicare, they're going to be paying more for their insurance premiums. Is that what we want to do? I don't think so. And you cannot ignore these facts. And so I would ask those that come forth with these replacements, why in the world do you do this? Why do you support a bill that will hurt so many Americans? And that's been demonstrated over and over. Why do you hurt a bill that will hurt so many of your constituents? That your constituents cry out to you, please don't do this. And they give personal testimonies. And so I would urge our colleagues, after the emotional appeal of Senator McCain, to do things in a bipartisan way. Take a moment, reflect back on what your constituents have said, not just some of your constituents. Listen to all of your constituents and ask yourself, are you doing the right thing? Let's improve our nation's health care system. Let's not make it worse. And let's do it in the spirit of the uplifting words of Senator McCain and what he said. Let's do it together in a bipartisan way. Mr. President, I yield the floor.